So the Emirates Arthritis Foundation was established in 2006. It was launched under the patronage of Princess Haya, and it was initially set up as a CSR initiative for a bone and joint clinic, and from there we have now grown to a fully fledged self-standing foundation. Our purpose is to increase the awareness of arthritis here in the UAE, and also to help support those patients who suffer with arthritis by having education sessions, by having patient support groups, and also helping lobbying with insurance companies and government. Unfortunately, yes, there's still a big lack in the education, the awareness levels. However, initially when we first launched the foundation, a study was done and it found there was a 24-month delay between someone first having the first side effects of the disease to actually being diagnosed and getting the right treatment. So that's nearly 2 years trying to find the right doctor, find the right medication. Now, so 5 years on, we redid the study and they found that the delay has reduced to 14 months. So you can see by the increased awareness, people are getting to the doctors sooner, the doctors are putting them on the right medication sooner, and people are actually, getting the treatment. It's made a massive difference. So let's hope another 5 years we can reduce the statistic to 1 month or less. Basically, the foundation was initially established before I came to Dubai. However, I came over and I was looking for a patient organisation where I could get support about seeing the right doctors, good physio places to do, exercise programs, and the Emirates Arthritis Foundation was there for me. I've had arthritis since I was 2 years old, and obviously in the UK it's very construed as an old person's disease, and it was really great and refreshing to come here and actually meet lots of younger people who are actually talking about arthritis and making a difference. So it's been great. Basically, we're the first point of call. If you look for arthritis in the UAE, in the UAE on the internet or whatever, we come up and we're there as a point of contact. It can be so overwhelming. You see there's 50 specialists. Well, who do I see? What sort of doctor do I see for this and this? We try and help highlight the best path for you. We obviously highlight as well insurance companies who can cover the medications required for arthritis and those that don't. And also we try and give important information, so offer guidance.
I'm Dr. Umaira Bacha. I'm a rheumatologist in Dubai. Well, a rheumatologist is someone who takes care of 100 types of arthritis. There are 100 types of arthritis, and most people commonly think that arthritis affects old people. That's only one type of arthritis, osteoarthritis, which is a wear and tear sort of arthritis, which is associated with sort of a degenerative or a wearing away of the cartilage, which is the cushion between the bones. But the other 100 types of arthritis can affect anyone, from babies, young children to old people. And it usually occurs because your immune system is overactive and gets overactivated and attacks the body from within. So it causes a lot of inflammation and swelling in the joints. And these type of arthritis, the autoimmune arthritis, especially rheumatoid arthritis, affects young people and can be extremely destructive. So a young person who gets this disease, rheumatoid arthritis, and doesn't get treated can get disabled within 10 years and have to stop working. So we take it very seriously. Well, I arrived in the UAE in 2005, and at that time I collected data on my first 100 rheumatoid arthritis patients I saw here. And we actually found, as you say, that the awareness is really poor, because patients from the onset of symptoms to actual diagnosis, it took them 14 months to get diagnosed, because they would either go to the wrong doctor, they would not see a rheumatologist, they may go to different kinds of specialists, they would not get a diagnosis. So it was a 14-month delay, and a further 6 to 7 months after that to even start on the right kind of treatment. So then we have launched the Emirates Arthritis Foundation. We've done a lot of media campaigns, press releases, a lot of work has been done. And so we similarly collected data again in 2010. And we're releasing the results of the study. Actually, we're going to present this paper in Chicago next month at the American College of Rheumatology meeting. showing that over the last 5 years, these concerted awareness campaigns which have, or concentrated awareness campaigns which have taken place in the UAE have led to a decrease in this delay of diagnosis from 14 months to 7 months. And patients are now getting treatment within 1 year. So we're really happy that public awareness or increased awareness, public education can actually improve the diagnosis of rheumatoid arthritis. We still feel a lot should be done. Patients should be getting treated within 4 to 5 months of disease onset. So we'd like to keep working on this to improve public awareness. Arthritis in general, people usually think that it's a disease of old people. They think it's caused by cold weather or something they ate. And these are all not true, because arthritis can affect any age. Different types of arthritis are worsened by different weather. In fact, rheumatoid arthritis becomes worse with heat and humidity, whereas osteoarthritis can be worse in cold weather. And then you have the thing that it's because of food, the myth that it's because of food. We've actually not found an association between food and most types of arthritis, except for gout. Gout is caused by high uric acid in the blood, and there you should avoid red meat and alcohol, but these are the most common myths.